live on YouTube, so you never know who might be joining us.
Gotcha. Okay, so let's begin. Hello, everyone. My name is Rusty May Squires. I'm a peer counselor here at the agency, and I want to welcome you to our 14th annual and first community forum, virtual community forum. We usually have this in the month of May for Mental Health Month, but with COVID wreaking havoc on our world, we've decided to go virtual. Please accept our apologies for any tech issues we may encounter. Heather and her team have worked very hard to make this work. There's a chat box to enter any questions you may have, but if you have, you will have an opportunity to later in the forum for open discussion. Our agenda for today is to provide information and updates on our agency, our program profiles, peer support specialists, COVID-19, and other presentations we hope you will find helpful and useful. For those of you who aren't familiar with Zoom, Heather's going to do a tech etiquette presentation to help you understand the buttons and the use of Zoom. Heather, off to you.
Thanks, Rusty. Okay, let me just change my screen over. So it's hard to believe since we've been living on Zoom, I feel like for the last 7 months, but just in case we're not savvy on the platform, we want to make sure everyone's kind of operating from the same space. So let me go ahead and share with you guys some tips and tricks. So this might be what your screen looks like. Can everyone see the example of the Zoom screen? So down here on the bottom, we have your mute and unmute button. This is super important because as you can see, there's many of us online all at once, and we want to make sure that we're keeping and taking turns. So if you would like to speak, you can go ahead and unmute your microphone. So that would look like this, where it doesn't have a red mark on it. And then if when you're done speaking, you can press it again and it'll show that it has a little red mark on it. We would love to see your face. As Rusty said, this is typically an in-person event, and it's a great opportunity for us to meet the people that we serve and people in the community. If you're uncomfortable showing your face on camera, not a problem. As you can see, I don't have mine on. So you can go ahead and press that video off button, and that'll show a slash on the mic on the camera. And then that way you can have your privacy if you wish. If you'd like to participate and raise your hand and join the conversation, if you can press at the bottom, you'll see there's a kind of a picture of people. It's an icon of people. If you press that, what'll come up is this participants list. And so what'll that allow you to do is press the little blue hand, and that'll let you raise your hand, and we will get to you as soon as we can. Another way, like Rusty said, you can participate today is by joining the chat. And so you're going to go ahead and press that little speech bubble. It'll bring up the chat button right here, the box, and then you can go ahead and type your questions in. Like I said, we will try to get to your questions as quickly as we can, but we do have presentations lined up. So don't worry, we're monitoring those and we will make sure that you get your needs met. Let's see, anything else? Oh, if you would like to rename yourself, that's an option as well. You can click on your name and change it if you would like to remain anonymous, or you would like to include your gender pronouns, whatever works for you. So we're excited to have you guys here on Zoom. I'm going to go over, like Rusty said, a few more things. So can you guys see this tech etiquette button? Let me see. Right here, this visual. So this is just a quick reminder that if you can use your video, we'd love to see your face. If not, that's okay. A great way for us to make sure that we're hearing you clearly is to use headphones. So if you have headphones for your phone or for your computer, just makes it a little bit clearer. It also makes sure we don't hear your background noise. But if you don't have headphones, you can still participate, not a problem. Again, like I mentioned earlier, super important to keep yourself muted unless you're speaking. This will help to get rid of background noise, as well as make sure that we're all focusing on the person that has the floor at this time. If you are calling in by phone, we'd love to know your name so that we can call on you or we can include you in the conversation. So like I mentioned, you can go ahead and change your name by clicking on your phone number if you see it pop up, and then you can put your name there so we can make sure that we're including you. Again, like I mentioned earlier, if you have questions, you can go ahead and throw those in the chat and we'll get to you as soon as we can. If you're having some troubles with tech, I'm happy to assist you as much as I can. So you can go ahead and put those in there as well. I'll be monitoring the chat box. And then finally, if you have lost connection, which happens to all of us, right? We're all on Zoom these days. We all have a little bit of spotty internet. Just go ahead and log back on. The link that you joined with will still work, and we'll be able to bring you in if you're waiting in the waiting room. And then most importantly, we are here for you. We want you to participate. We want to hear what you have to say. So please feel free to engage, to raise your hand, to drop questions in the chat box, because we really want to hear your voice. So we will also be doing some polls. I'll talk a little bit about that later. And I think that's it. So any questions, Rusty?
No questions. Okay, so what is the purpose of the community forum? So let me start by saying Pend Oreille County Counseling Services provides treatment, education, and support for mental health and substance use disorders, promoting individual choice, community, and belonging for wellness and quality of life. We care about our consumers and appreciate their contributions towards our efforts to improve our services. Our mission statement is making a difference with compassion, integrity, and hope, and we live by that statement. This forum also gives our community an opportunity to provide feedback and input about our services and how we can improve what we do, and hear about new changes, updates, and learn about mental health and substance use awareness. We want to hear from you. You are important to us. So we also want to make this forum fun as well. So I'm handing this back to Heather for our first activity.
All right, let's see if this works the way it's supposed to. Could you see? Oh, here we go. I'm going to go ahead and throw out a poll. This should show up on your screen. So we just want to know who's joining us this morning. So if you can just click, this is all anonymous too, so please don't feel pressured to either answer it or to participate at all. We're just trying to make this a little bit fun. Did that go away when I did that? Okay. So if you can just let us know where you're joining us from. We'd love to just get a sense of who is here this morning. And the good news about participating in polls is there will be prizes. So each time that you participate in a poll, we can go ahead and write that down. And then at the end, if you want to share, I'll send my email, or Rusty will put out her email, and you can send her an email letting her know that you were participating in the forum today, and you will be up to win a prize. So let's see, we have 11 out of 14 people have voted so far. Oh, 12. I'm probably one of the people that hasn't participated. Let's see, we have people still coming into the rooms. We want to make sure they're participating as well. So it looks like 92% of people that are joining us this morning, Rusty, are coming from a community agency or organization. Okay. We have one community member that joined us this morning.
Nice. Welcome.
We have 15 people in attendance. Thank you for participating.
Okay, so next are program profiles. Carrie, you're going to talk about prevention coalitions.
Sure. Okay, good morning. I'm Carrie McKinley, Prevention Program Manager over here at Pend Oreille County Counseling. So I've been with the agency for 8 years now doing prevention work, and most of our prevention work surrounds community coalitions. And right now our coalitions are part of Washington State Healthcare Authority's Community Prevention and Wellness Initiative. So the short term for that is CPWI. We have 3 coalitions here in Pend Oreille County, the Newport Youth Task Force, and Beverly Sarles is the coordinator. She's on the meeting as well. For POCCS, we have the Panther Country Coalition, and Donna Kelly is our coordinator. She's also here on our meeting. And then up in Selkirk, we have the Selkirk Wellness Coalition, and Angie Rowley is the coordinator up there. We've been doing this coalition work for 7 years, starting with POCCS, and then Newport and Selkirk came on board in 2018, November of 2018. So we really love to have all of our partners involved in the coalitions, and we have members from healthcare, we have parents, we have youth, we have school administration, law enforcement, local and tribal government is part of the coalitions, and we work together to come up with strategies to help our youth. And the focus is youth substance abuse prevention and also mental health promotion. So yeah, if you have any questions, I would be happy to answer them.
Okay, thank you, Carrie. Up next, we have Jennifer for SUD. And
oh, wait, real quick.
Oh, okay.
Real quick, Rusty, it looked like we had someone raising their hand. Annabelle, did you have a question?
Yeah, I just wanted to know, Carrie, could you or one of the coalition coordinators kind of throw out some of the ideas that you've done in the community, like the take back projects, things like that, just to give a sense of some of the pretty cool things you guys are doing?
Sure. Yeah. Some of our strategies are, like Annabelle just mentioned, the drug take back days. We do a lot of education and awareness events. We have billboards up in the community quite often. We do direct service programs like parenting programs such as Guiding Good Choices. We do programs within the schools such as life skills, sport prevention and wellness. We have youth coalitions, just all kinds of fun activities to keep the youth engaged and on track. Yeah, thanks, Annabelle.
Okay, thank you, Carrie. So Jennifer.
Good morning, I'm Jennifer. I'm the clinical director of the outpatient services at Pend County Counseling. So we offer both substance use and mental health services. And those services, if a person needs both, can be done in separate concurrent ways, or they can be combined into what's known as our co-occurring services that address both mental health and substance use at the same time. So our mental health services and SUD services provide outpatient to any age from teeny tiny babies to 110. So our primary population is Medicaid, the state health insurance, and we on the SUD side, I'm sorry, stumbled on my words there. We provide assessment, outpatient, and intensive outpatient services. And with mental health, we do individual counseling. At this point, we're not offering group counseling, but we have in the past. And some degree of family involvement. I don't know that I would necessarily call it family therapy, but involving the family, working on relationship dynamics, boundaries. And then we also have a wraparound program for youth, which one of our WISE folks is going to touch on here in a bit. Due to COVID, we are still offering services uninterrupted, but they are being offered by telehealth at this point, where the intake and the counseling right now is done either by phone or by Zoom, if that's an option for our clients. So we are hoping to be able to continue to provide services without interruption through COVID. And so far, we've done a great job being able to do that. Our groups for the substance use disorder are being provided by Zoom so that we are able to keep people engaged that way. I think that's all I have. So I will hand it off to one of our WISE members who can talk a little bit about the differences with the WISE program.
Hello, my name is Brittany Saint-Marie. I'm the WISE Care Coordinator with the WISE team. To start off, the WISE team stands for Wraparound with Intensive Services. It is a voluntary program that takes a team approach to meet the needs of youth and their families. The team consists of a mental health counselor, a WISE Care Coordinator, a peer partner who has lived experience, and a family partner that also has lived experience. The goal within WISE is to help the family and the youth come up with a shared vision that we help them to work towards. It is a 24/7 based program, meaning that we have flexible hours. So if you work till 6 o'clock, we can meet you at that time. It's very flexible hours. It's also very intensive care coordination. So all parties involved, so school, anything that you need support with, we make sure that everybody's on the same page. We also do crisis services, so we're also available to the family 24/7 for crisis support. And prior to COVID, we were community-based, so we could meet you in your house or the school or wherever you'd like to meet. But with COVID, it kind of put a damper on that. So hopefully, we're hopeful that the future will let us return to that. if you guys have any questions about how to make a referral or you just want more information, you can always call the front desk and ask for the WISE Care Coordinator, and I'm happy to answer any questions that you have about our program.
Okay, thank you, Brittany. So I'm not sure if Candy's available to talk about crisis services, Jennifer.
I'm actually right here, Rusty May.
Yay, thank you, Candy.
Okay. My name's Candy Alley. I'm the Crisis Services Manager, and one of our main jobs in the community is to keep people safe. So we get a lot of phone calls from the Sheriff's Department, from the hospital, and from community members when somebody's in crisis. And crisis can look different for every person. So we try to look at these things on an individual basis. And it could be somebody deteriorating with a serious mental illness and they need to get back into treatment. So we'll try to go in, assess the person, and determine whether or not they need to be hospitalized. We really try to be careful of protecting people's rights. We don't want to overstep. If the person is still capable of functioning in the community and can get the help that they need at the least restrictive level, that's really what our goal is to help people where they're at, get the services that they need, and get back on their feet so that they're functioning in the community again the way that they normally do. One of the things that our program is really working on doing is building up capacity. We're working on bringing in more DCRs, so we've had some creative ideas going back and forth in order to do that. And in the future, what we would really like to be able to do is a lot more hands-on in the community, face-to-face outreach with our Sheriff's Department and with family members in the community, if we can do it safely. And so safety is one of the big factors in this whole program of DCRs. And if I didn't explain before, a DCR is a designated crisis responder for Ponderay County. So what we really want to do is prevent people from getting to that higher level of care, such as hospitals and inpatient treatment or even jail. We want to meet them in the community, give them some information, make our faces available to them so that we're building trust and rapport with people who need our services. And we're in hopes that that will encourage them to come in at will to outpatient so that we can keep them on top of things. We do deal with a lot of suicide calls, and every now and then we'll have a domestic violence type of call. And what we try to do with those is just make sure that that person is getting treated if they need it. And sometimes people need to go inpatient to get better, and other times people just need to talk it through, develop a crisis plan or a safety plan, and they're good, and give them some resources for outpatient care. So that's kind of what we do. It's kind of exciting work. I like it, and I hope that all of the staff working for POCCS also like it. We're here whenever you need us, 24 hours a day.
Okay, thank you, Candy. So next we have our presentation for peer specialists. Heather.
Okay, sorry about that. I was stuck. All right, Here we go.
Okay. How do I put this on picture mode?
Can you see it?
Yes, thank you. All right, thank you, Heather. So we're going to start this peer support specialist, aka peer counselor. They're both the same. Beck and I are going to facilitate this together. Next. So again, my name is Rusty Mae Squires. I've been with the agency since 2007 and as a peer counselor since 2013, but I'm not really a counselor. So my role is to help people bridge the gap from where they are to where they want to be, empower self-care, teach mindfulness skills, breathing, relaxation, help them see things differently. To help them build their self-esteem, because it's a fact that growing up, what people say to them becomes their inner voice. So it's helping them build their self-esteem and get their voice back. We advocate for them as well until they get their voice. And in addition, I also help individuals with whatever they need in addition to counseling that will help reduce their anxiety and depression. Becca, you're up.
Hello all, my name is Becca Teeters. I am the WISE Youth Peer Partner. I have been with Ponderay County Counseling for 3 years, but I just recently became a peer counselor. I'm coming up on 2 years. My role here as a youth peer counselor for the WISE team is to take my lived experience as a youth with mental health and turn it around and use some good for it. So with that, I help engage youth with what they're wanting and needing in their treatment. I make sure that what they're wanting for their individual needs and their culture beliefs line up with their families, so it can be a kind of like a musical. So everybody's happy, but everyone's getting their needs met also. Sharing my lived experience can help the youth promote their hope and recovery, that there is an end in sight and they don't have to live with their mental health forever. I empower and support the youth to advocate for themselves, but also to find their own strengths and build on their own strengths. And then last but not least, I help promote them to take leadership in their recovery and treatment. And this really helps the end result of recovery. Next.
Awesome. Thank you, Becca. So Becca and I worked this out where I will narrate the rest of the PowerPoint, and then if she has anything to contribute for each slide, she'll speak up. So what makes a peer counselor? Helping people achieve their personal goals is one of life's most rewarding experiences. It's enlightening to help them invest in themselves, to provide support, encouragement, and resource information. We also share relevant personal experiences that foster hope, resiliency, and decrease stigmatization of mental health illness. It gives them hope when they know they're not alone, when we share something that happened to them that also happened to us and how we got through it. So it gives them hope that there is hope we can recover from this and move forward. Next. So what is the role of a peer counselor? Even with their own values, ethics, and practices, we still have to maintain the policy and procedures and mandated reporting. But the difference between the peer counselor and a regular clinician is that we're one-on-one with we're on the same playing field as the people that we work with, because of the fact that we can share our own experiences to help them. So our roles are a little bit different. So we support each other in recovery and sharing our stories. We power together, not power over. It isn't about being an expert when we come in, when we meet with the people. We're not. We've had lived experiences and we're helping them recover and get better. And so we want to connect them to their inner wisdom rather than advising or counseling. We do not give advice at all. We suggest, we offer, we teach. I'm an expert at not being an expert, and that takes a lot of expertise. Next. So peer counselor duties, and this is not all inclusive. We assist individuals and families in developing their own goals. They are the masters of their universe, so they know what works and what doesn't. And it's not a cookie cutter thing, because everyone is different. Everyone has a different experience of life. So we share our own recovery stories that are relevant and helpful in overcoming obstacles. Stories inspire and motivate. We promote self-care, self-love. I can't promote that enough. That's so important. We also have a wide range of services, such as developing supportive relationships, self-advocacy, stable housing, education, and employment. And those are a lot of the things that I can do extra while they're seeing their counselor. We apply knowledge using specific tools and following certain rules to help people get past obstacles and reach their goals. And the most important thing is we teach others with deep respect. The rules counselors follow include setting up boundaries, keeping confidentiality with those that we help. Next. So where can peer counselors work? Just about everywhere. In many agencies and organizations with training. We also are trained in the Wellness Recovery Action Plan groups, mindfulness, motivational interviewing, and crisis intervention. Places where they can work are the community mental health centers, hospitals, foster care systems, crisis lines, peer-run recovery organizations. We also can be a bridge for those leaving inpatient or incarceration facility, helping them transition back to the community. So this is our resource page. I can provide my email if you have any questions or want any more information, but here's some to become a peer support person, websites, a peer support program email, and a phone number, the Wellness Recovery Action Plan, a great website. That's also, as the peer counselor training as well as the RAP training, is a 5-day training. And so that website has a lot of information. National Association of Peer Supporters. And then if you type in occupational profile Washington State Peer Support Specialist at the Department Washington EDU, that's another shows demographic type information. Also, our website, our county website, pondereco.org, also has a lot of information about our county and about our programs. So transformation in the world happens when people are healed and start investing in other people. Next. So this is just a heart of what we are all about, all the positive things. The possibilities are endless with what a counselor can achieve and do. Next. So if you have any questions, you can add those to the chat box and Heather will monitor that, and also during the open discussion. Okay, Annabelle?
So, yeah, Rusty, I did want to put a pitch out there that counseling services, and not just counseling services, a lot of partners throughout the community are very interested in developing the peer specialist workforce. We're hopeful that we can continue to have positions and hire, but even if we did not, we really want to develop that pipeline, that workforce. So there's quite a bit of interest, and we're hoping part of the reason for sharing this is not just to let folks know that this is a service, a resource, but also just to let folks know this is an opportunity, potentially a career opportunity. And so in particular, counseling services, we'd really like to support folks who might be interested in becoming peer specialists, LGBTQ peer specialists, crisis response peer specialists, the youth. There's a big need for a lot of youth peer specialists. And this is something that the state is very much interested in and supporting. So there could be opportunities just across the state and within the region. So if you're interested in becoming a peer specialist, please reach out to us. Rusty May talked about the websites, but if you need to talk to somebody in person, be welcome. Contact us, contact Rusty May and Becca. They've been through the certification program. They could probably give you some more details about what that looks like. It's not that scary. You don't have to be, you don't even have to be a high school graduate, okay? You can get through the program, because really what the peer specialist is predicated on, the premise is lived experiences. Person with lived experiences in recovery at a place wanting to help others. So really welcome. Hopefully we can get some folks who'd be interested in this, and just know Counseling Services wants to support anyone who wants to do this pathway. That's Absolutely. All I have to say. Thanks.
Absolutely, it's very empowering. I encourage all of you. Okay, Annabelle.
We have a question.
Yeah.
Rusty, Andy's asking, could she do something like that, such as peer counseling, in conjunction with her internship through the agency, or maybe that's for Annabelle.
That might be for Annabelle, and that question has come up.
Yes, absolutely. So we want to develop people in-house, obviously within the agency, but again, we really want to get some folks who are out in the community. Previously, we had some dollars, and we still do at this point, where we are actually helping folks, with transportation costs or a flight costs, or maybe in a hotel. Right now, I think a lot of the certification programs is probably available online because of COVID. But like I said, go ahead, give us a call. I think there's other agencies, I want to say the Camas Center, other partners in the community who are also employing peer specialists. But even if you don't have a position open right now, would just really encourage folks to just, go through the program, get that, put it on your resume, be ready when there's a call and you see an opportunity.
Okay, thank you, Anna.
And real quick, I just wanted to add too, with the program becoming a peer specialist, there is scholarships they offer. They also offer help with childcare. So they really have a lot of resources for you to get your peer counseling certification.
Nice. Thank you, Becca. So Annabelle, I believe you're up next.
What am I up for?
I'm just looking at the agenda.
Oh, I thought we had a poll going on right now. No?
Yeah, I can give the poll.
Okay.
Are y'all ready?
Yeah.
Okay. So hopefully you were paying attention. We're looking for a true or false answer here. Here's the poll. Remember, this is anonymous, but you will receive a possible prize if you participate. You have 16. Oh, y'all think you know the answer. Huh? I have 10 out of 16, 11, 12, 13, 14. All right, 87% voted. You guys ready to see what the answer is? We got a smart group here. 100%. You are correct. You do not need a college degree in order to be a peer specialist. And like Annabelle mentioned, you don't even need to have a high school degree. It sounds like they try to eliminate barriers, and the most important thing, your validation, your special sauce is your lived experience.
Absolutely. Okay, thank you, Heather. Now, Annabelle, you're up.
All right, I think I'm talking about the 1/10. So Heather, if you can get that slide deck up, that would be great. And just letting folks know, I have a monitor, so if you see me looking up, it's how I see everybody that's in the forum. So I'm going to be going back and forth with that. All right. Thanks, Heather. Appreciate that. Okay. So 1/10 to 1% substance use and mental health tax. So in 2005, the Washington State legislature passed a bill and that allowed counties to impose this tax. In Pend Oreille County, these discussions started as early as 2008. There's been quite some time. The commissioners understandably have been pretty concerned about adding a tax to the county. So we've revisited this idea over many, many years, okay? In 2019, the commissioners, in recognition of the increasing challenges, the gaps in the demands of behavioral health needs in our county, and having less confidence that there was going to be a state or federal solution, convened or approved convening a committee. And so this committee started in March and it has done quite a bit of work of local folks here. And I'm going to say that Pend Oreille County is now the 24th county to have passed the tax. That was passed on September 21st, okay? So some things to know, that this tax has to be used solely for the purpose of providing for the operation or delivery of new substance or mental health treatment programs, and or therapeutic courts, okay? It's very, very important that it cannot supplant expenses from county general funds. So these dollars, these revenues are not going to pay for potholes, okay? And it cannot supplant services already funded. So it's not going to be adding dollars to the counseling services program for services that we are required to do already under contract, okay? And actually the dollar's not necessarily going to go to counseling services. It goes to the county, and we can talk more about that in a little bit. I think next. Okay, thanks, Heather. Whoop. There we go. So why even ask for the tax? What's the need for it? Just really because the demand for the behavioral health services exceeds our current available resources. I have been, actually I should have introduced myself, my apologies. Annabelle Payne, Director of Counseling Services. I have been with the county since 1998, so a good 22 years. And over the years, I've heard from quite a few folks about a lot of needs in the community. You know, anywhere from, hey, we need to get postpartum home supports. Why can't we get some universal behavioral health services in the schools? When I say that, I mean that a lot of our money revenue that comes into the counseling department is very specific to Medicaid dollars. And so if you're not under the Medicaid program, a counselor going into the schools really couldn't see you or see the student. There's still a need for school threat assessments because these are not covered under the crisis services program. Questions or requests for more supports to older persons in our community. Obviously, we have this some limitations with our crisis response. We don't have a local crisis center. We don't have a local detox facility. There's housing and homelessness issues tied to mental health and substance use disorders. We've had some missed opportunities with promising programs. I remember at one point, some folks asking, hey, can we have an equine, equine therapy? This was not a program that qualified under the funding structures that our department was allowed. And we've missed some opportunities, some grant opportunities. So, and also we know that there's been some studies recently that have been pretty concerning. So just going to quickly share the 2018, for those who are not familiar, the 2018 Healthy Youth Survey. And this is a survey that goes across all 3 schools in our counties. And it showed that we have this, some depression with our youth that's pretty concerning. So for 2018, that survey showed that 30% of 12th graders reported experiencing depression, 38% of 8th graders, and for 10th graders who completed the survey, 47% reported feeling depression. Probably even more concerning is for those 10th graders, 30% considered attempting suicide in the past year. There was 117 respondents for the 10th graders, so that means 35 students considered attempting suicide. And 13% reported that they tried. That's at least 15 students. And these are only the students who completed the survey, okay? We also have some barriers pursuing some of the grant dollars and implementing these innovative models, like I kind of referenced earlier. So some of the dollars that we get into the county, some of them at least coming through the Counseling Services Department, they have strings, state and federal strings tied to them, and it makes it very, very difficult to actually use these dollars. Also, we, for Medicaid, it's probably good to know, few providers are willing or able to provide services at the low Medicaid and Medicare rates, and there are billing restrictions that often limit the scope of practice or who can provide the services. So for example, Medicare, you have to be a certain level of credential for Medicare to be covered. And that credential generally means you have to be a physician, a physician assistant, nurse practitioner, a psychiatrist, or clinical psychologist, or a licensed clinical social worker. So licensed mental health counselor is not going to get reimbursed for doing Medicare. And that creates a challenge. It creates a barrier for a lot of the work that not just counseling services, but even at the hospital, the Newport Hospital. So we just see that there's this need for local flexible funding. Next, please. So the initial focus with the 1/10 having it passed, we were looking at, we knew that we just couldn't cover the wish list, okay? And so we had to narrow the focus in order to make sure we can maximize the use of the dollars. With the understanding that this focus could change contingent on future needs and funding changes. Okay, so our initial focus is on the intersection of criminal justice and behavioral health. Thank you, Heather. We have some studies here. So some of the studies have shown that 83 to 89% of people with mental illness in jails or prisons do not receive care. We can say that is happening at the local level too, not because people don't want it. Our jail partners, the sheriff has definitely asked us, hey, come over here, help us out. And that has been a challenge for us to do that. And I'll speak more about that in just a second. Also, some studies have shown that the first weeks following release from jail or prison, a person is 12.5 times at risk of death or more likely to come into contact with emergency room services. Thank you. So kind of speaking about some of our barriers, you know, when we're asked to go over to the jail and, you know, give some services, even with people that are already enrolled in services, for those who don't know that right now, if you get incarcerated, Medicaid is suspended, okay? So you can be enrolled in services with counseling services, and during that time, if you get incarcerated, we actually are not able to help you because we have no dollars that would cover that. And if we provide a service and we have no way to cover that service, then it looks like it's Medicaid fraud because the majority of the dollars or contract revenues that we receive are Medicaid. Okay. Also, we did try good couple years ago. We would go into the jails and provide some group counseling, some cognitive behavioral therapy, and we were told it was very beneficial. We were told by residents that they got some benefits from it, and then we were told that we were not supposed to do that, okay, from the powers to be at the regional state level. So we had to pull those services, but it was enough time for us to get a sense that, hey, this seems to be of interest. The residents seem to resonate with having somebody come in and provide services. And it also provided a warm handoff so that when you're incarcerated, you know, sometimes we would lose people from release from jail with the recommendation that you come into outpatient counseling, and we would lose them. And we'd be less likely probably to lose folks when they see the counselor coming into jail and kind of go, oh, maybe this is not so bad. Maybe I am getting some benefits from this. And I actually know the name of the counselor, okay? Also, currently, there is some local efforts already occurring. And so this is an opportunity to enhance the capacity. Newport Hospital Health Services, they have a prescriber that goes into the jail and does manage the medications for the residents. And of course, it makes sense, you know, evidence-based practice, much better if you can do the counseling along with the medication piece. Thank you, Heather. And again, there was an opportunity to leverage some dollars quickly. So let's see, where am I at? Right now, we are pursuing a grant. It's a $500,000 grant that Better Health Together has put out there for the rural folks, rural counties. They're really focused on accessing, you know, behavioral health services for criminal and justice involved individuals. And one of the provisions with this grant is that you have to demonstrate that the grant dollars would not be the only source of financing. And this is where the 1/10 dollars would be viewed as a match. if we were to receive these grant dollars, then we could start services as early as the first part of January. If for some reason we don't get the grant dollars, we still have the 1/10, although that won't be able to be drawn down until probably next spring of 2021. Okay, and what we're hoping would happen with these more flexible dollars is that in the jail, we would have screening, counseling, whether that's individual or group, and we'd also have some transitional case management supports, not just during incarceration, but also after release. So what will this cost the taxpayers? Just making sure you know that a sales and use tax on non-essential goods. Again, food is an essential good, so it would not be taxed unless it falls under the category of prepared foods. So what is prepared foods? This means anything that's heated, combined, one or two items together, or sold with utensils. Also businesses, where if 75% of their business total of food sales, if 75% of it, then they're required to charge sales tax. So these are the places like the restaurants, the taverns, coffee shops, okay? You could go to the Department of Revenue and see what are all the other exemptions, and there are actually quite a few of them listed. And we're going to assume that a good portion is going to be borne by people passing through the county. So right now, if you go to Spokane and buy some items that are non-essential, then you are contributing to Spokane's chemical dependency and mental health programs. Next, please. All right, so this means, what does 1/10 of 1% amount to? It amounts to 1 penny on each $10 purchase of non-essential goods. I like the visuals, that's why I put this out there. Otherwise, $100 purchase, a dime on $100. And what we see, though, again, is the evidence demonstrates that every dollar invested does not only just saves lives, but also saves dollars. All right, thanks, Heather. Questions? Great, it sounds like everything made sense then. Okay.
Thank you, Anna.
Thank you.
So next we're going to do a presentation on self-care during COVID.
It's a coming.
Okay.
Oops. Can you see that?
I can, it's in.
So Anna's.
Oh, showing my stuff.
So many PowerPoints, it's like magical. Okay, hold on. Oh, please. All right, can you see it now?
No.
Oh, okay, let's try again. Can you see it now?
Yes, not full screen now.
Oh, Lord, okay. One moment. I'm just going to get rid of your other PowerPoint. Okay, there's only one PowerPoint. Let's do this again. Now? You see now?
I do now, thank you.
Okay, sorry.
Awesome. Okay, so this is self-care during COVID. Some things we'll cover: mindfulness practices to reduce anxiety and stress, self-care for parents during COVID, and some good resources. Next. So how can you take care of yourself during COVID? This is a very stressful time, unprecedented. It is normal that you and your loved ones might feel anxious, scared, or angry, and you are not alone. It is okay to seek out and ask for help. Next. So the media covered what to do to take care of ourselves on the outside, like physical distancing, washing your hands, wearing masks and gloves, sanitize, 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 and wiping down the groceries. But they don't talk about the inner shield. It's vital to take care of our immune system during this time, but our emotional well-being has been put at stake, so it's vital to take care of ourselves as a whole. I can't push self-care enough. So what we eat or what to take out, move and be mindful, mindfulness, ways to connect the brain and body, and sleep like your life depends on it. Next. So what we eat and choose to eliminate from our diet. Food choices also impact anxiety and stress levels, which can impair the inner shield and mental health. Move and be mindful. Any exercise you do can strengthen the immune system, and this includes even housework. I was so happy to hear that. It will decrease episodes of illness and reduced inflammation. Moving and being mindful can have a huge positive effect on our mental health as well. Mindfulness. Often the mind and body are so disconnected that even while you're exercising in the here and now, your mind can be 1,000 miles away or in the past. So it's being in the present allows us to slow down and concentrate on what's important in this new normal that has been thrust upon us. Next. So connect the body and the brain. Do mindful meditation, like take a bath, go for a walk barefoot on the rocks or grass, and do yoga. It's different for everyone, whatever works for you to reduce that stress and connect your brain and body. It's good for your emotional well-being. It helps you become more grounded so you can think clearly about what your next step is. Sleep like your life depends on it. This is when your body does its best work. It's another vital part of self-care. And so many things can come into play that disrupts our sleep. Anxiety, pain, physical and emotional, illness, busy schedules. So during this pandemic, we have been forced to change and reevaluate the way we do things to see things differently, whether we like it or not. Lives have been disrupted. Familiar structures and routines have changed, often resulting in feelings of stress. Sleep is just another vital thing we have to do. So what you do during your day and even right before you go to bed, it affects how you're going to sleep at night. So practice letting go of your day. Write down troubles you had during the day and give yourself permission to let them go so you can deal with them tomorrow so you can have a restful sleep. Next. Self-care for parents during COVID. The one positive thing I can say about this pandemic is that it has made us reevaluate what is really important in our family life and our work life. It's also created a lot of stress, economic stress, schools closed or limited time stress, losing our job stress, being quarantined stress. So self-care is vitally important during this time to help us adapt to this new normal. Next. So keep familiar routines and make new ones. Think about the things that don't have to change, like your morning routines and evening routines. Family meetings are very important, even just between two people, very important. Check in with each other. Maintain good boundaries. Change often brings resistance from others. Get all the family members involved. Children and teens are most likely to follow the schedule if they're part of the process, including exercise. Include exercise, outside time, screen time, and other activities like being silly together, dancing together, singing together. It's about bonding time. And this would also be a great time to teach children skills like cooking, cleaning, work in the garden. Gives them something to do than screen time. Next. So make time for yourself. Be realistic by setting realistic goals. It's okay. Practice forgiveness and self-compassion. These are unprecedented times. There's no playbook for this now. So now is the time you can create what works for you and your family. You're doing your best during this difficult time and you are enough. So self-care, even now with busy schedules, can be a difficult time to find that time for yourself. Both men and women, yes, even men, need to implement time for themselves. Many people say, I just don't have time. It takes determination and commitment. If you are a two-parent household, check in with each other on important needs for the day. Next. If you're a single parent, it might be more difficult to find that time to be alone or do self-care. You can look at your situation and see what you can do to spare at least 5 minutes of quiet time for yourself. Be thoughtful and intentional how you are treating yourself and your body. You can be You can create a space to recharge and decompress. This could be like taking a shower, walking outside in nature with your dog, taking time to read. Take notice of your environment and perhaps the most challenging, care for yourself. By participating in your life, you can help reduce one of the greatest insults to any infection or life-altering event, and that's fear. Keeps us in control. Here's some resources. So the American Academy of Child and Adolescent Psychiatry, National Federation for Families for Children's Mental Health, Washington Listens, the coronavirus.wa.gov is a good website. BigLifeJournal.com is a great website for activities for children, keep them busy and teach them skills. And how to support each other during COVID, optionb.org. It's a new book by Sheryl Sandberg and Adam Grant about facing adversity and building resilience and finding joy. So take care of yourself. You're worth it. Next. So if you have any questions, you can add that to the chat box or wait till the open discussion. Thank you. So Becca, I believe that you're up next. Or Anita and Becca.
Does that mean I'm going first?
Yeah, I'm pulling up your slide deck right now.
I'm just here for support, Anita.
Okay.
And filter any questions.
Can you see it?
Yeah. Hi, my name is Anita Waterman, and I'm the school-based counselor for Ponderay Counseling. And so I go to the schools in our county, which includes Selkirk, Cusick, and Newport. When I have a client that attends one of these schools, they have the choice of meeting with me either at the school or in my office, or if they are up north, then we have a office at the Cutter Theater in Medellin Falls. When I go to each school, they provide me with you can go to the next slide. And here's a list of the school counselors. If you are interested in coming into services, you can either contact our agency directly for school-based counseling, or you can contact your school counselor, and here are some points of references for each of the different schools. So when I go to the school, they provide me with a private space, and depending on the child or the youth and their attention span, I will usually meet with them anywhere between 20 minutes to 45 minutes. And if you know someone that's interested in services, you can contact our agency. But if you don't attend any of these schools, that's fine too. If maybe you're homeschooled or attend a school outside of the county, but you live in Ponderay County, then you can just contact our agency directly. And in Washington State, youth that are 13 and older can enter in services and without their parents' permission. And students that are 12 and younger will need their parents' permission and involvement to be in services. At this time, the Newport School District has gone back to digital learning, and with the exception of students with IEPs, and most of the students with IEPs are still attending in-school learning. And Cusick is all digital at this time, and Selkirk is still continuing with in-person learning, but they're actually deciding tomorrow whether or not they're going to continue with that. So, and this is all depending on how many COVID cases that are going on in our county. So within a few weeks, all of these schools may or may not return to in-person schooling. So for me, it's equally important to provide services to all the schools in our county. At this time, I don't have enough clients to drive to Ione and Medellin and the Cutter Theater. So I've been coordinating with the Selkirk school counselor, and she sets me up. She sets my client up with an iPad or a tablet, and then puts them in a private room for me to do my counseling sessions with them. Right now, with most of the schools doing digital and our agency doing telehealth, it can be really difficult for children to be in services. Most kids struggle to talk on the phone and to be on Zoom. So it can be even especially more difficult if they spend half of their day in class doing Zoom. So my goal is to do the best that I can to accommodate these students that struggle more with doing digital counseling sessions. So if you have a youth that maybe you're interested in having in services, let us know ahead of time if, like when you enroll in services, if they need to be seen in person. So that's all I have. And if anyone has any questions, feel free to ask. Thanks.
Thank you, Anita. So Heather, did you want to do the My Strength now before we do open discussion?
Yes, let me just get that up and running. One moment. Is there any questions so far? Does anyone want to talk about kind of what are maybe some trends about COVID that we're seeing that maybe we can provide people with some information about how to, I know you mentioned it in your slides, Rusty, but also for you too, Anita, is there some trends that we're seeing with people in our community and ways that we can support them specifically?
Just provide support and validate their experience, give them resources to help them deal with this. We're all in this together.
I'd like to emphasize Washington Listens as a resource. This is rolled out at the state level. It's specific for COVID support. You can be anonymous. I think they're only collecting information at a very aggregate level. Just, are you from Ponderay? Just to see how many people maybe from Ponderay are using the resource. But this is that's a resource where I don't want to enroll in counseling services, but I do need to talk to somebody right now. And it's maybe not a crisis so much that I'm going to ask counseling services to come out and do some kind of evaluation. But at 2 o'clock in the morning, I need to talk to somebody. I'm kind of just stressing out. And my understanding is supposed to be a good resource for that. So just emphasizing Washington Listens as a resource for everybody. And that's across the state. You do not have to be in Ponderay County. You could be in Ponderay, you could be a resident of Ponderay County, and maybe you're over in Seattle, and you can still call Washington Listens.
Oh, that's cool. Right up here, I'm all logged in. Ooh,
By doing that, Heather, also yeah. I see that there is a question on the chat. Is the resource list available on the agency website? I think that's the resource list that Rusty May you've put up. I'm assuming all that is on our website.
I'm not sure, but I'll check that out for both.
Okay, so it's either on the website. If it's not, it's going to be.
Yeah, I'll give it to Kelly to put it on the website.
Excellent, thank you.
Do you want the whole PowerPoint on the website or just the resources?
I think just the resources.
Okay.
Yeah.
Thank you.
Okay, so I'm pulling up the PowerPoint right now. I'm going to share my screen. Can't see it. All right. There we are. Can y'all see that?
Yes.
Yes. Okay. So My Strength is a new platform that we provide. We started by providing it to our clients, but with COVID coming in, we realized this would really be a great resource for our community at large. So I'd really just like to talk with you guys about what My Strength is and how you can access it, whether you're a client or you're a community member. So My Strength is a digital platform that provides support for behavioral health needs. So think of it sort of like Facebook-ish, being that you can access content online, but the difference is that it's actually vetted content. It's evidence-based content. So there's videos, there's articles, there's quotes of the day, and lots of cool things, and I'm going to give you guys a demo on that. So you can access it from your computer, from your phone, as you can see, and there's a variety of things, as you can see over here. These are all the different modules, so you can target things depending on how you're feeling. If you're struggling with depression, or you have substance use disorder, or maybe you're experiencing chronic pain. There's a variety of curriculums that you can go through, or if you just want to be inspired for the day, and if you're like me and you love memes, you can look through memes and see what they have available that might get you into a good mood or something to hold on to. Again, like I mentioned, these are evidence-based resources. So what does that mean? Evidence-based means that it's been tested and it's been proven to be effective for these specific diagnoses. So when you go into the depression module, evidence-based means that these resources have been shown to improve health when it comes to depression. The great thing about MyStrength is that it is self-paced, it is self-accessible. This is not replacing therapy in any way. So that's what we started with it as an augmentation to our services, but it is appropriate for individuals to log on there and to go in there. Our crisis information's in there. You have access to all the modules, but again, just a caveat that this does not replace counseling, but it is kind of an additional resource to counseling. So some of the things that you can receive are support with, like I said, depression, anxiety, stress overall, sleep, mindfulness. As you can see right there, I think there's 13 different programs that they offer. So a variety of substance for you to move through, as well as things like wellness, spirituality, social and community. And what's really nice is that it's completely personalized. So you can have access to all of these resources or just a few. If you want it to be spiritually based, you can. If you don't have an affiliation, you don't have to. So I like that it's customizable and that I can receive the support that I need personally. So I think that's really, really neat. Like I mentioned earlier, evidence-based, these are all the different workbooks that are basically been put into a digital form. So if you've ever gotten homework from your therapist, or you've ever been given a handout or a video to watch, now everything is right here at your fingertips on MyStrength. And you can even either work with it with your counselor, with your peer counselor, or you can work on it on your own. So how does it help? Like I mentioned, it is evidence-based. They are looking at a holistic model, which is something that we're moving towards, as Annabelle mentioned, with our integration with the hospital. So we're looking at, as you saw, there's chronic pain, which is dealing with the body, as well as, if you're dealing with anxiety, and then that spiritual component if you choose to participate in that. We are able to gather data. It is anonymous, but we can see that people are getting better. And this is not only on a local level, but all of the data is aggregated in entire, any user from MyStrength, again, is completely anonymous, but the numbers show that this is a great resource and tool to support your recovery. Again, it is personalized and it's relevant. So you're going to get the most state-of-the-art activities and access to evidence-based models that are just coming out today. MyStrength is constantly updating their resources. So they have resources specifically for COVID. So like you mentioned, Annabelle, if maybe somebody doesn't need to access counseling, but they're just feeling really stressed out, specifically about COVID. Maybe they've lost their job. Maybe they're sick and tired of being home with their kids. Maybe they're trying to deal with balancing kids at home, doing school, and all of the other things. There are resources specifically for that, which I just think is so wonderful. It is accessible 24/7. It is at your fingertips. So you mentioned 2 o'clock phone calls. You can also jump onto MyStrength at 2 o'clock in the morning, and it will be available to you, which I think is wonderful. It's safe and secure. You are completely anonymous. We're going to give you a login, but that does not track your name. We don't even know who signed up. It's completely between you and the provider, which is MyStrength. You will sign not a waiver, but like a consent when you sign in, but we can't see anything about any material that you put in there. So it's completely confidential, which I think is really important for you to know as well. And then again, proven to be helpful and supportive in this process. And I think especially right now, I think we're all in need of resources like Rusty said a few times, this is unprecedented. So as much as we can support each other, I think we'll get through it together. And like I showed you guys, this is something you can use on your computer, your tablet, your phone, whatever you have accessible to you, you can use it. So these are some of the features, and like I said, I'll show you. But I think what's really neat is you can track your progress. So as you log in, you will see a screen that will ask you about the things that you wanted to track. So whether that's your mood, whether that's your sleep, whether that's your self-care activities, you can put that information in. And then like you see over here, it's going to track that for you. So you can actually see, are you getting better? Are you doing worse? Rusty made great connection to mom. What are you eating? What are you taking out? All of those things that she mentioned, you can now track in your mind. I think it's great. You can put little notes there. So let's say last night I was in a rush on my way home. I stopped at McDonald's. I woke up this morning with a big tummy ache and I don't feel very well. I'm just in a rut. I'm going to track that. And I might notice over time that when I eat big hamburgers at night, that when I wake up, I always feel crummy. So I might change my diet and see if that does anything. So just being able to track that and have information to inform how I can get better, I think is a really cool tool. So these are some examples, and I'm going to go straight to the resource to show you guys that, but they have videos, modules. I might just jump into it right now so you can see it. So let me just stop sharing for a second and go onto the platform. Okay, so where are we? Here we are. So like I mentioned to you guys, when you log in, you can track your emotional health or whatever you determine that you want to check. I'm going to be tracking my emotional health, but if you want to track your sleep, your pain, as you saw, there was a module for stopping smoking. There's substance use, whatever you want to track, you can, and it's completely confidential. So today I'm feeling really great. I'm so excited to be here at the community forum. Okay, I haven't had all the coffee yet, so I'm a little bit slow. How I've been doing with exercise? Not at all. It's been too cold for me. How's my pain? Not too bad. I'm feeling okay this morning. And finally, didn't sleep very well. I was a little anxious about this morning, but I'm not feeling too stressed. And then here, like I mentioned, you can say, you can write your notes. And that'll save in my profile. Any questions so far?
So Heather,
yeah,
you might be speaking to this, I'm not sure, but just really emphasizing this is free.
Yes.
Yes.
Absolutely. So it is free to all community members and to our clients. So My Strength is not something just like Facebook where anybody can sign up. My Strength has to be provided by a provider. So this could be your medical doctor. In this case, Ponderay County Counseling Services has taken on the cost because we believe in this so much that this can be a tool to help others. Really good timing with COVID as well. So yeah, clients or participants or community members do not have to pay anything for this service, which I think is really wonderful. So as you can see, I've been tracking my sleep. So this is the first thing that comes up, but let's say today I don't really want to track my sleep. I can go over to the top and there's, depression, coping during COVID. Let's look at that one. Let's see what kind of resources they have for that. If it's going to work, I don't know. There we go. Ooh, time for a quick inspiration. Relax and enjoy this inspiration. Should we watch this? This looks neat. Let's see. So this is how to process your emotions during COVID. And I just want to go through this to show you what possible things you could be coming up with. So I love that it just kind of talks you through what this experience is like being in COVID and how things are shifting. I think what this platform does for me is kind of normalize. If you're not, we're all isolated right now. So if you've been home and you're with your kids, or you haven't been able to go to work, or maybe you lost your job, or you just been not able to visit your family. I think a lot of times we feel isolated and we feel alone. And so what My Strength has really been a tool for me, at least, is showing me that it's totally normal to feel that way. And when things are, your routine is disrupted, like it said right here, or you might not be connected to other people, like these are normal feelings. And then it goes on to give you some skills on what to do next. So again, here's tons of modules that you can go through, look at. If you're feeling excluded, fear and worry, sadness and loneliness. I'm kind of feeling fearful and worry. So then it'll give you a solution. The situation is confusing. So I think that's kind of neat that it normalizes what this means and how you're feeling. And then I can continue on. Some thought, some time for some reflection. Identifying your thoughts. So then you can continue. And again, just giving you tools. If you don't have somebody to talk to or you don't feel comfortable calling, this is another great resource to go to. So it's kind of walking you through the process, asking you to reflect on what's actually going on. Giving you prompts, what you can do next, giving you examples. And then you can save and complete. Pretty easy, right? And then if you want to, did I think this was helpful? Yeah, I thought it was pretty helpful. And then I can go to a different one. So you can spend as much or as little time on here. If you're not really into activities, another great place to go is this inspiration tab. So this is where I find it to be pretty similar to social media in the sense that I feel like there's a lot of visual on social media these days. So looking at different quotes. This one, worry is a total waste of time. It doesn't change anything. All it does is steal your joy and keeps you very busy doing nothing. Great thing to put in perspective if you're feeling a little anxious today. Forget what hurt you, but never forget what it taught you. Deep. So again, just really wonderful, inspirational. Yeah, and then as you move through things, you can favorite them. So you can start that customizable piece that we talked about. You can put a star on them, come back to it later. Again, look at all the different options that you have to work on. And then if you've had enough for the day, you can log off. So I would encourage you to jump on here to explore. Again, this is completely free. Once you log in, you will always have a login. You will deal with My Strength. If you forget your password, there's options for that too. And I think that's it, unless anyone else has any questions. Oh, I do want to show you this part. Again, if reminding you that My Strength is not here to replace counseling services. It's not here to replace crisis services. If these activities are not helping you to calm down or are not giving you what you need, we do have a Get Help tab, which does have our phone number if you need to call and make an appointment. It has our hours when we're open. It also has our crisis service line, which is this number right here, and our after hours number. It also has this sheriff's department. So again, this is a great resource, but monitoring yourself if you're finding that you're not able to kind of regulate your emotions, or you're finding yourself getting a little bit worked up or having thoughts of suicide or homicidal thoughts, then that's when you would need to call the crisis service line. So the code for this platform is, I will type it here, or I'm going to actually show you guys. I'll just throw up the card so you guys can see it. That might be more helpful. All right, so I'm going to share my screen again. So, wrong code. Sorry about that. Okay, let's try it again. Let's see. Okay. This one. Alrighty. Here we go. You guys see it on here? Great. Okay, I'm just winning today. Look at that. Okay, the code is POCCS community. Obviously, I have too many possible options in front of me. So any questions about my strength?
So Heather, can you just kind of walk us through, so somebody would get onto My Strength, the website, and it's pretty intuitive how to open up an account, and then that's the reason why that code is so important?
Right, because like Annabelle alluded to, this is free for the community. The only way to access it is by using a code. And so you'll put in your email and then it's going to ask you for your access code. And so that's what you're gonna put in there. That's what that means, is putting in that code. And I'm trying to pull it up. Let me see. So the community code, and I don't know if it's on our website or not. I can put it on our Facebook page, Annabelle. I don't know what your thoughts are about this, but yeah, it's going to walk you through and ask you for the code. And then once it asks you for the code, it's pretty much going to do like any website that you're signing up for. It's provide, your demographics. So that would be maybe your name, your age. Again, I don't think everything is required. Remembering that, here we go. The more information that you can provide, the better that it can give you personalized results. So here's the code. You can see that, POCCS community. So like I said, you would go to the website, you would click sign up, and then it's going to ask you for that access code, and you're going to put in POCCS community. And then it's pretty easy after that. You just follow the prompts, sign in. You would create your own password. Again, if you're like me, as you can see, I'm slightly unorganized. I forget my password often. There's a forget password option, and that would come directly from My Strength. Also, they have, if for some reason your account's glitchy or something's not showing up, they have 24-hour tech support through an email. I believe they also have a telephone number. All of that information is available on their website. They're absolutely wonderful, and they respond in a really timely manner. So we don't manage the account. All we're doing is giving you guys access to it. Of course, if you have questions, something we want to put together in the near future is like a tutorial. Now that we have a YouTube page, we can put that information on our YouTube page and provide you guys tutorials of walkthroughs and things like that. But for the most part, it's pretty easy. So if you use any social media platform, even if you don't use it actively, it's very similar as far as the login process and how to navigate it. I see we have something in the chat. Oh, okay. Thanks, Annabelle. Appreciate it. So any questions, comments, thoughts, any testimonies? Anyone used My Strength before, want to share their experience with it? No? Okay.
Okay, thank you, Heather. So shall we open it up for discussion?
So,
anybody has any questions or concerns?
this is also an opportunity, like the efforts with the 1/10, the community forum over the years. This is where we got some of the information about the needs in this county, in this community. So really want to open up and encourage that, these are the barriers that I'm facing or I've heard is happening in our county. That's important information. And so we really, really use this forum to kind of collect that information.
In the past, a lot of the barriers have been transportation and housing, daycare.
Childcare, yes.
Childcare.
hopefully maybe that's some of the silver lining, Rusty, with COVID is that we are now able to provide telehealth services. So, and we are totally understanding of kids in the background.
Yeah.
So
very much so. Or our animals. Our
yes,
lovely animals.
animals.
Our pets.
All right. Well, if you're like me, sometimes my great ideas happen 2 hours later. So feel free to get a hold of us. Send us an email, give us a call. We very much are interested in not only feedback on counseling services, but also just what are the needs in our community. Any ideas, no bad ideas. Can't promise what we can run with, but we want the information still. Otherwise, it'd also be helpful. This is our first time doing a digital platform. I'm going to say first, thank you, Heather. I'm thinking we'll do even better with the second session at 4 as we kind of work through some of these transitions. But I know, Heather, you've got probably about 50 different screens that you're trying to monitor as you go through these transitions. And I also want to say thank you to the staff, especially the peer specialist, Rusty, May, and Becca, who did a lot of work in just trying to put together the community forum in this new way of doing it. So thank you, you guys.
Well, a big thanks to Heather for that, because she worked with the team to create this for us. So it was pretty awesome. Thank you, Heather. Thank you, everyone.
Oh, my pleasure. Thank you, everyone, for being flexible. I know change is, even when it's cool, it's also hard. So I think we worked well together to get through it. And I'm excited about the possibilities, even if we do go back to in person, because I would prefer that. I like seeing everyone in person. We still now have an option that we can stream it. If you were following along on Facebook, we have been streaming this through our YouTube page. So check back later, or if you know anyone who wants to participate later on this afternoon, we now have options in the future of how we can disseminate this information, which I think is really exciting.
For sure. So do we want to do that third poll or wrap it up?
Well, I have it if you want to do it.
Yeah, let's do it, man.
Let's do it.
Prizes are on the line.
Yeah, right.
All right. So this kind of as an overall, we're looking for your opinion. What are the most pressing behavioral health needs in our county? All right, looks like the majority of people have participated, and looks like the consensus is all of the above. So the options were depression, anxiety, substance use, or all of the above. So yeah, I would agree with that. I think we've touched on all of these, and of course we're not limited to these. Zoom is limiting us to not allowing for participation if you had other ideas, but definitely feel free to pop it in the chat box or even send a private message to me if you want me to include your ideas and answers. But I think it's clear that there are needs in our community, and like Annabelle said, we are here to support those needs. So any feedback you want to provide, I put Rusty May's email in the chat box. Those are for prizes, but also like Annabelle said, if you guys have an idea or things that you feel like we are missing, we want to hear your voice. So thank you.
So yes, just going to emphasize that if you are interested in a prize, we're also going to do a random draw just for all participants, non-counseling services staff, but for all participants, there's just going to be a random draw. So there's a t-shirt on the line. So give us your name if you are interested and your size. L, M, XL, whatever it is. I think we even have double XL, right?
Cool. Yeah, go ahead and email that to Rusty, rsquires@ponderay.org.
Okay, so we are coming to a close for our forum. If anybody has anything else that they want to talk about. Otherwise, I want to thank all of you for joining us at our 14th annual first virtual Zoom community forum. Like Heather said, we are having another forum at 4. So if you know anybody who could not attend this one, let them know they have another opportunity to attend. And for 2021, we can only hope and pray that we get back to doing in person. Thank you again for being with us today.
Yeah. Thanks.
Bye.